However, apparently we're being recorded. I'm okay with that. I hope you are. In the second version of the experiment, which is cool, they were given a more subtle and more ambiguous discrimination task. It was dark gray boxes versus black boxes. And there, when higher levels of stress occurred, the mice took longer to discriminate between dark gray and black boxes. Higher levels of stress can be very beneficial when things are simple. When they get ambiguous, no, that's not how it works. So in the last couple of years, when we've had high levels of stress and high levels of uncertainty or ambiguity, like, can I go out of my house today or like tomorrow? Or, is something going to be available in 3 weeks or in a week from now? Like, it's all ambiguous. Everything's uncertain today. It's unbelievable. You can't rely on technology. You can't rely on anything today. And in that context, when you have high stress, that's when it gets not only difficult to discriminate between situations, but basically it affects our performance. It affects everything. So all the more reason today that we need to be taking this seriously. Okay, let's go ahead to slide 14 for me. It says recognize your limits. You can keep moving. 1, 2, 3. There you go. Let's recognize our limits and go with that slide. So when we're in these kinds of situations where our stress is high, ambiguity is rampant, there's not much you can do about our work lives. We have to recognize that there's only so much in our control, and there's only so much that we can do. That's usually not the kind of thing that we get taught in grad school. I certainly was not taught that in grad school. I was taught to conquer the world and that everything's really under my purview and my capability. But, recognizing our limits, aside from the potential spiritual overtones of it, which we're not even necessarily speaking about yet, healthcare practitioners, we want to assist, we want to support others. We want to be able to, manage situations, but there's certain things that we can't do. There's certain things that are beyond our capacity. They say on the airplanes, right? Put your own mask on first. I don't know if we do that. I think often we're so worried these days about taking care of our patients that we don't really recognize our limits. And if a patient's burning you out, well, we might need to set a limit and say no. And yes, there are broader, I think, spiritual overtones to that. And I hope we'll get to those soon. But even before we do that, I think it's important to recognize that a perpetual demand on ourselves engenders long-term stress. It undermines our ability to perform, to be effective. I mean, if we're not, examples of self-care, then it's very hard, I think, to support our patients. To that end, please don't be afraid to say no. Please say no. In fact, I'll even challenge everyone here. Say no at least once a day. And maybe say it to your supervisor. It's not comfortable. Nobody likes saying no, but I don't think I can do that today. I'm really sorry. I'll get it done next week. I'll try in a month, wherever it is, I'll keep it on my list. But that is an important thing, to know our limits and to know that we're not perfect. We're human beings. And this is definitely a part of it. And this is before we get to anything spiritual. All right, let's go to the next slide. Here's one that, well, frankly, the last couple of weeks I've been struggling with it myself. So I'm kind of glad to speak about it. Hopefully it'll make, if I'm talking to anybody here, it's me today, that in the digital age, we know everything all the time and it's completely overwhelming. And it's one reason why our anxiety is so high. It's just disrupting our sleep because it's keeping us up at night. And there's very solid evidence that checking devices is correlated with higher anxiety. And yes, what's the chicken and what's the egg? In some ways, it doesn't matter. What matters is that the impact of technology on our emotions is massive, and we do have to plan, which means having time off every day from technology. I will invoke a spiritual concept here. There is a concept of a Sabbath, people taking a day off from work. And I don't know if you should take a day off of your technology a week. I think that's, there are people who do that. I actually do that myself. If I didn't, I don't think I'd be able to survive, frankly, in this day and age. But that's tough. What is doable, though, is an evening a week or an hour a week where we don't pick up our phone, where we put it away, and where we're doing that. And I think that, yes, we're here to speak about spiritual strategies, but again, if we're completely connected to technology all the time, then there's not much point in talking about spiritual or any other strategies for that matter. Okay, let's move down 2 more slides. Self-care isn't selfish. Well, that one didn't work. Well, that's too bad because it's one of the most important slides. You know what? Just keep it there. We can live with our imperfection today. That's okay. The slide says, although you can't read it, self-care isn't selfish. And I suppose it's apropos that for present company, it's not there because for us, we kind of have to envision this ourselves. We can't just have external stimuli reminding us of this. Healthcare work, none of us went into this field because, in order to become gazillionaires. But we went in, there's an aspect of selflessness. We're trying to take care of other people. That's the whole point. Please, when you're taking care of yourself, it is an investment in being able to take care of other people. That's what it's about. It is not selfish. I'll also mention this. Our interpersonal connection with others and frankly, our spiritual connection are founded on being able to take care of ourselves. So if we're not sleeping adequately, if we're not having an adequate diet, exercising and getting out of the house, engaging with friends, all of these kinds of things, for especially if you're in healthcare, it's not selfish. We're going to skip the next couple of slides, but I'll summarize it. Let's go down to social support. Yeah, just to summarize the previous 3 slides that we skipped. Exercise, I'm hoping people are getting 150 minutes a week, 2 hours and 30 minutes a week, 5 times 3 hours, whatever. Sorry, 5 times 30 minutes. I live in Boston. We try to aim high, right? 5 times 30 minutes is a good thing. 5 times a day, even 3 times 50 minutes, you could do that. But moderate intensity exercise. And the reason I'm recommending that is not for your mental health. That's what the American Heart Association recommends. In terms of mental health, surprisingly, in fact, I would say shockingly, the American Psychiatric Association and the American Psychological Association do not have exercise guidelines. I have no clue why. It's very clear evidence that if you exercise, you're going to be less depressed, you're going to be less anxious. This is one of the best, is the best recommendation for one of the best recommendations for mental health there possibly can be. Yet the American Heart Association recommends. So let's at least be, if you're gonna have a minimum level, at least do what's in the best interest of your cardiac health. In terms of your mental health, it's probably more, frankly. And in terms of diet, sleep, how many people here, let's do a show of hands. How many people here get 8 hours of sleep a night? Rachel, you can use the electronic hands, by the way, or put in the chat box. There you go. Really? Wow, I'm impressed. Okay, we have 3 people out of 42. So not a great hit rate. How about 7 hours or more a night? The 3 can keep your hands up. I'm in the 7. Here, I'll put one up. Hold on. Reaction. I'm putting a heart. Annalie gets 14 hours because no, only 7. That was only 1 hand. Okay, I don't know if everyone's voting, but I'm not seeing. Okay, do I see it? How many people get less than 7 hours a night? Because I counted 7 people there out of 42. Yeah, I'm seeing a lot more hands go up. Okay. One thing about sleep, you can bank it a little bit. You can catch up on the weekends a little, don't do it a ton, completely sleep deprived during the week and then crash on the weekends. It's not great, but I'll just give you a bit of a spiritual idea of sleep. Human beings are not meant to go 24 hours a day because we are finite creatures and there's only so much that we can do during our lifetimes and during each day. Aside from just the burnout pieces and the physical limitations that human beings cannot go without sleep, there's an aspect of accepting our limits and saying that's not my job. I'm a finite creature. I start here, I end here. That's my capacity is here. Not here, not way beyond. And the act of going to sleep is actually in many ways a surrender and saying, I'm not working for the next 7 hours. Whatever comes through my inbox, I'm not going to respond to. I'm going to recharge. You know, if I'm being really invoking the spiritual, I'm going to let someone else take over and not deal with it myself. That's a part of this. And I suppose these are spiritual frames for self-care or for aspects of our relationship with ourselves. But whether we do it for spiritual reasons or otherwise, this is something that we definitely need to do. Another aspect, though, is social support, and that's our current slide. There are amazing medical research, there has been, I should say, on the role of our interpersonal relationships and healthy aging, coping with stress, our responses, even having physical consequences to it. Robert Waldinger, the famous Harvard study on adult development, found that the #1 factor in healthy aging, more than physical health, more than mental capacity, financial material success, more than IQ, more than anything, was our relationships with other people. If you have a satisfied, strong relationships with people at age 50, you're the healthiest at age 80. Simplifying the results, but that's basically what he found. There's other incredible experimental research, and I'll tell you, our interpersonal relationships with each other, in many ways, we need to surrender. And we need to, because when you involve another person in your life, you can't predict or control them. I mean, you can try, but you're not going to succeed at that. And even if you do, you're not going to have the actual emotional connection with that person, which is really what gives us the longevity, the healthy results and consequences of it. Just one incredible article done. It was back in 2011. It's already a little bit outdated, but it was published in the Proceedings of the National Academy of Science by Naomi Eisenberger and colleagues at UCLA, that female partners in long-term romantic relationships underwent fMRI while they received painful stimuli. I think it was electric shocks to the legs, if I recall. And they were viewing pictures of either their partner or strangers. And pain ratings were significantly lower, and reductions in pain-related neural activity, to the extent that those individuals in the scanner had what's considered a secure attachment with their partners. And to the extent that they had a less secure attachment, they had more pain and more pain-related neural activity. And it was mediated by the ventromedial prefrontal cortex, and certain firing in the dorsal anterior cingulate cortex, the anterior insula, a really fascinating piece. And there's other experimental relationships that secure attachment. What's been fascinating about the attachment literature, which came into being in some ways by John Bowlby and colleagues over the course of the latter half of the 20th century, the idea of secure attachment, it runs very counter to, in some ways, the Western concept of connection. Western interpersonal connection is basically a business deal. I need them, they need me, and it kind of works. Actually, it's not even I need them and they need me. It's I want something they have and they want something I have, and we get together and there's a business deal. The concept of secure attachment is actually much more than that. I would say it encroaches on the spiritual. It's so fascinating. Because what Bowlby said is, to the extent that I can make myself vulnerable and need another person and have them come through for me, where I'm not in control, they're in control, and I give that up and I place myself in their hands. He started doing research with infants and children, infants and parents. And the concept was that parents who come through for their kids, infants who can rely and have a secure attachment to their parents, develop strong bonds, healthy bonds, and eventually those kids have the strength to be able to get out and venture into the unknown, wild, crazy, ambiguous world with confidence. In a fascinating twist in over the last 20 years, the relationship research in terms of romantic relationships has found that these general concepts are the most advanced in predicting the success of people's interpersonal relationships. So what I was trying to say before, and I'll say it now, is that our social support, the best thing we can do is need somebody else. Independence is completely overrated when it comes to social support. What we really need is interdependence, where I need you and you need me. If you're in a relationship where you need somebody else, that consider yourself blessed, because that gives you the opportunity to surrender and to allow for that person to be there for you. I don't know if I'm being clear how there are spiritual overtones here. Hopefully by the end of the talk, it'll be a little bit more clear. But the bottom line is those aspects, the mirror of those in the interpersonal space seems to be the most transformative in terms of our relationships with others. All right, let's move down 2 slides. Up until this point, I've been speaking not really about spiritual support. I've given you some concepts of how support for ourselves, our relationship with ourselves, our relationship with others. And granted, I've given you some spiritual overtones to them and maybe some rationale, some spiritual or religious, maybe religious, spiritual framing concepts, that ways in which we can go about getting more sleep, taking care of ourselves more, pushing beyond our comfort zones, which also has spiritual overtones, and developing real relationships with others where we can surrender. But there are aspects of spiritual support which are more direct. And I would say that some of the most powerful methods of coping in the current era, which is marked by such incredible uncertainty and ambiguity, are born out of the world of spirituality. Spirituality can engender, firstly, what is this? So spirituality involves anything connected to the sacred being that which is above this world, that which is non-physical, non-corporeal, I would say, not rooted in or grounded in the physical world, something which is greater. Now, what is that? That is user's choice when it comes to spirituality, because it's a broad concept and it really involves anything that a person sees as greater. For many, in fact, for most people in the United States anyway, that would be God, otherwise known as God, or a higher power, or some sort of higher, greater being, which is non-corporeal, who is non-corporeal and separated from reality. Not everybody thinks that way, and that certainly can still be spiritual. But the idea of spirituality is something which is non-physical. Just to give you an idea of how prevalent these concepts are, over 90% of Americans have some belief in God. Over 2/3 have certain belief in God or a higher power. And even in Massachusetts, about 50% of the which is not the most religious state in the union, about 50% of the population goes to religious, spiritual religious services, actual services of worship, on a weekly or greater basis. So these are very powerful. In our hospital, in McLean Hospital where I work, we've sampled our patients that spiritual coping, people going through difficult times, 80% of our patients use spirituality in at least some way to cope with distress, 80%. And for many, their levels of positive coping, to the extent that they have positive aspects of coping, can predict their reductions in depression over the course of treatment. I've had a paper which looked at that a couple of years ago. Okay, let's go to the next slide. This is a cool one. In December 2020, the Gallup poll identified that 34% of Americans had excellent mental health, the top anchor on their four-point scale. In December 2021, the number was, in December 2020, after 9 months of pandemic, it was 34% who had excellent mental health. A year prior, so 3 months pre-pandemic, right, December 2019, the number was 43%. 34 versus 43. It's a 25% increase, okay? Or a 25% decrease, sorry, from pre-pandemic to post-pandemic, a 25% decrease. Fascinatingly, there was one demographic group which was the least negatively impacted by people in terms of mental health. And that was individuals who attended religious services at least once per week. In fact, and even though they weren't going during the pandemic in person, people who attended services virtually or in person at least once per week actually saw an increase in mental health from December 2019 to December 2020, versus those who did not go had a drop of 12 to 13 percentile points, which was equivalent to a 35% decreased likelihood of having excellent mental health over the course of the pandemic. Now, what's the chicken, what's the egg? Do people with higher levels of mental health, are they more likely to go to services? Entirely possible. But I think these are broad brushstroke trends that should give us pause and make us think that maybe the increased uncertainty that we're experiencing today, maybe there are some ways of managing that. I'll give you a couple of strategies and ideas. Okay, let's skip down to the next slide. Okay, let's talk about gratitude. Gratitude, I have a bunch to say about gratitude. Gratitude is known as a spiritual emotion for a couple of reasons. One, all major world traditions, all 5 major world religions have concepts of gratitude, practices for gratitude, in fact, and certainly concepts of gratitude. They highlight the importance of gratitude. And experimental research suggests that gratitude increases when people pray, even if the prayers do not specifically involve gratitude. And furthermore, even on the theoretical level, if you're grateful to somebody else for doing something, then you could be grateful without a spiritual aspect to it, right? I'm really thankful to my friend I'm thankful to Courtney for helping me out with this presentation today, and for sending me lots of emails and for all the coordination. I'm also really thankful right now to Lee for advancing my slides. I'm very grateful. That's not necessarily a spiritual experience. But what if I'm grateful for something like my hand? I am grateful for my hand. I'm very grateful. This is an amazing piece of machinery here. 5 fingers, got all sorts of like digits things. Thank you, Lee. So it's an amazing thing, but it does raise a question of who am I grateful to, right? If you find $5 in the street, you're grateful to who? The person who dropped it? Not really. So there's an implicit aspect of spirituality when people are grateful, at least when it's not interpersonal, when it's not interpersonally constrained. If you're grateful for the ability to see, smell, breathe, or walk, then there's an aspect of it that's spirituality. What's nice about gratitude is that it doesn't necessarily need to be specified who or what one is grateful to. So for people who are still searching and figuring out their spirituality, or they haven't given it much thought, or people who might not want to give it that much thought, it can be a really sort of good entry point. And it's a good thing because it's known to have a salutary effect on human emotion. There's experimental research from the social psychology literature that when people count their blessings as opposed to their burdens, their anxiety and depression tends to decrease. That's in non-clinical samples, which I would assume applies to most people who are health care practitioners, of course, although of course there are exceptions. And there are, even in this last year, there are a lot of things to have been grateful for, like running water. Of all the things we had struggled with, most people most people had running water the entire time. Most people had indoor plumbing. There were even some benefits of the pandemic, like more time with loved ones to some degree. Access to modern medicine. Okay, so some people did, some people didn't. It gets a little dicey, of course, but nevertheless, better air quality for a little while, right? More likelihood of seeing animals in your backyard. Bottom line is, when people conjure up aspects of gratitude, they can tap into pieces of spirituality, and that can be helpful. However, I have a big disclaimer here. One, gratitude should not, if gratitude is going to make you feel worse, because sometimes people start to feel grateful and then they start to complain, and they're like, oh, look, I'm complaining. I should be grateful. You know, what's wrong with me? I should be more grateful. And that's obviously not going to be a healthy way to go about this. It's important also not to hoover up all sorts of negative emotions and just simply move into a state of gratitude. If you're really struggling with some major difficulties, or even if they're not major difficulties, if they're landing on you in a certain way, gratitude is not intended to be the kind of things that engenders shame or guilt or just, pushes away negative emotions. But if you're going from, being bored to gratitude, it can be helpful. If you're going from not having strong negative emotions to being more grateful, that's definitely a positive thing. One clear, quick, easy way to do this is having a gratitude journal. Write down one positive thing that happened every day and read through it once a week. I think there are even apps for it today, gratitude journal. And it's also, if you have kids, this is great. Gives them something to do and keeps them focused on things, and they'll remember it for the rest of their lives. Kids who do this kind of thing. Okay, we can go to the next slide. Let's talk about meaning making. Now, meaning making came out of it's actually a famous concept. It came out of the work of Viktor Frankl, who is a Austrian Jewish neurologist and psychiatrist, actually a Holocaust survivor. Interestingly, I'll tell you even how he came to meaning making. It's kind of cool. He noticed that in the dire conditions of the Nazi concentration camps, there were many people who continued to survive, not only to survive, but to some extent to thrive, until after the December break, like until after the beginning of January. And the reason why is because they felt after January came, people really started to plummet. And it wasn't because of the weather. It was because people had a sense, I'm going to be home with my family by the end of the year. It was like a mark that they had. And people can endure incredible suffering and incredible stress as long as they see that it has a purpose and that it's going somewhere, as long as they can see the end in sight. But when people lose sight of the end, they lose sight of everything. That was what he noted. And he developed logotherapy out of this, which is essentially a way of helping people to make meaning out of their suffering. So when it comes to meaning making, there are higher order spiritual questions that come up, like, why are you alive? And what is the purpose of your life? How do you help other people in your community, in your world? What are you passionate about? What are you built to do? What do you love doing? What makes you thrive? What makes you tick? Now, we have to be careful sometimes, because answering these, if we start to ask these questions and don't have answers, it can actually make things worse. Meaning making is powerful medicine with a main effect and a negative effect if we're not careful. But I do think it's worthwhile pushing through and trying to make meaning in what we do. A, seeing that the help that we provide our patients will one day help them. And B, if this is what we're here to do, if we were placed in some way to this era of history in order to make a mark in the lives of the people who are struggling in our professional and personal lives, I mean, what's more important than that? So keeping that at, I wouldn't say necessarily the front of our vision, but contemplating it for a couple of minutes on a weekly basis, I would imagine this is a good strategy to use for many. All right, one more slide. Because we want to do questions and answer, right? Is that right, Courtney?
Yes, that's correct.
All right. You sure you're not just being nice?
No, we absolutely love questions from the audience.
Because I asked. I mean, I'm happy to keep talking, but I'm taking my cues from you. All right, let's talk about embracing uncertainty. So psychological science has taught us very clearly that human anxiety is mediated by intolerance of uncertainty, the inability to tolerate uncertainty. If we can't stand not knowing what's going to happen next, you're going to be more anxious. And to some degree, it really is that simple. This is one of the biggest contributors, by the way, to our society's maladaptive way of dealing with COVID-19. Guess what, folks? It's a pandemic. It's unpredictable. Might there be a fourth wave? Sure. Might the whole thing go away tomorrow? Sure. Life is uncertain, and we don't like to accept that, right? These devices that we have, they have all sorts of predictions. What's crazy is that even though those predictions are notoriously wrong, with bated breath, we're refreshing our screens, like what happened with the last election? How many people were up that night or for the next 3 nights? The predictions meant nothing. Annalie was, me too. And it meant nothing. And I knew it meant nothing. But that's the nature of the society in which we live, is that we can't embrace our uncertainty. Unless from a spiritual perspective, we actually stop fighting this and embrace it and recognize that human beings are finite. This is our domain of control is like this big, that's it. That's all you get in one lifetime. I think the current crisis in many ways is calling upon people to accept that we're not invincible. We're not impervious to risk. We need to practice humility and make peace with the simple fact. I actually wonder whether this can explain that finding that I shared before, that individuals who have spiritual and religious practice on at least a weekly basis actually fared in some ways better during the pandemic, because they all were already, to some degree, were accepting and embracing the fact that life is uncontrollable. There are aspects of life that you will never be able to control. And the sooner that we make peace with that, I think the better. Now, what does this have to do with spirituality? I'm being somewhat intentionally vague here, but I will say that when people have a belief in something that's greater, they don't necessarily need, when they have a secure attachment, if you will, to a higher power, to something that's beyond us, when they're able to surrender that they're not always in control and to recognize that there are human limits, then it's a lot easier to embrace uncertainty. It's a lot easier actually to recognize that there are advantages to not always being in control. I'll give you one analogy and then I'll end. So I used to fly a fair amount. It's obviously been curtailed during the pandemic, my travel. And one of the things I love about the plane, about getting onto a plane, is I step over the threshold from the jet bridge onto the plane, and I'm basically stepping into an aluminum can that's going to be, shuttling me at 600 miles an hour, 20 to 30, sometimes even 50,000 feet, often over like large bodies of water, which is objectively perilous. And I have no control at all. My favorite part of the plane is I sit in my chair and the pilot comes on and says, hi, or, I'm pilot so-and-so, and I'm going to be flying you to here at such and such feet, and everyone have a wonderful flight. And then the intercom goes click and the door closes and I have no control over that plane. And I am delighted because I don't know how to fly a plane. You don't want me in that cockpit. I don't want to be in that cockpit because it's not my job. My job's to be a passenger sometimes. Not always. Sometimes I get to drive, but not the plane. And I'm very happy with that. And I think that, to me, that in some ways becomes a spiritual experience, because when we can let go, when we can trust others, when we can place ourselves in the hands, so to speak, of another being, whether that's corporeal or non-corporeal, I think it can really enhance our lives. Okay, you can go ahead 2 slides, so that way people have my contact information. I guess I'll just make one concluding point, which is this, that as healthcare practitioners, I think that in some ways we're socialized not to think in terms of higher order values. We're really socialized to think in terms of very practically helping people, what we need to do. And it's very critical for us, I believe, to step back and to just appreciate the incredible accomplishments that we've done over the last couple of years, how we've been there for so many people. And to think about the meaning that has, to take a couple minutes to appreciate the opportunities that we've had to be able to do that. And also to recognize that, well, we can only do so much. And, if at the end of our lives, at the end of the pandemic or whatever it is, we've done what we can, well, I don't think there's any being that could ask much more of us than just that. Thank you very much.
Thank you very much, Dr. Roseberry, and thanks also for allowing enough time for some questions. So if I may, I will start with a reflection and a question. So first of all, you have written about spiritually integrated psychotherapy. And, for the benefit of the readers, I want to show this book, which just came out if people can say this. It is called Spirituality and Mental Health Across Cultures, in which you have a chapter. And I'm happy to say I have a chapter as well on Hinduism. And many of things that you say really resonate with me from that perspective as well. So if you could expand upon spiritually integrated psychotherapy, that would be helpful. The question I have is your analogy of walking into that aluminum vessel and then surrendering to the pilot is an excellent metaphor for surrendering to a higher power. But my question is, what about those people of us who, it is easy to surrender to someone who you can see and know. But when there is the question, we have no idea if God exists, if there is a higher power that exists, and so on. What would you advise to those people about that kind of an agnostic individuals?
Sure. I think that yeah, for people who do have a level of faith, obviously it's easier to invoke the spiritual. For people who don't, who either are agnostic or they, are even atheistic, I think it's important to recognize that there are certain things that are beyond our control, and to embrace that, as opposed to seeing those as sources of pain points, difficult aspects in our lives, and just being humble and recognizing that there are certain limits. And I think that's a close approximation in some ways of that. I think it's in some ways easier when you invoke the spiritual. By the way, I'll just mention one more thing. I actually think it's easier to have faith in something which is non-corporeal than something that's corporeal.
Yeah.
Because anything that's material, it's only going to last so long. But something's immaterial. In some ways, the more vague it is, the more hard it is to conceptualize, the easier it is for me to give up my level of control. But that's just personal. I'm just speaking very and not only anecdotally, but personally here. This is my own experience. So I'll mention that. But I think that even if people don't have a sense of belief, we can take some wisdom from these spiritual concepts and recognize the limits of our control. And I think that that's extremely adaptive for stress reduction in the current era.
And about spiritually integrated therapy?
Yeah, spiritual integrated therapy has really taken off like a bit of a shot. Only a couple of minutes to the buzzer, but I will tell you this, that when I sampled our patients at McLean Hospital, to what extent do you want to have spirituality as a part of your treatment, I was shocked and floored that more than 50% of our patients in Eastern Massachusetts wanted to have spirituality to a fairly or very much extent in their treatment. So I will tell you this, that especially when individuals are coming in with depression or anxiety or other symptoms, I do think it behooves us to, even if we don't believe ourselves, to at least ask our patients whether they want to discuss this with us and to give them an opportunity to do so. This is often very much a part and parcel of their recovery and an aspect of what we need to do as practitioners.
Yeah, I'm looking at the chat box. I don't see any specific questions, only praises for how wonderful your talk is. But there is time for maybe one question from the audience. So just please speak up. Or if you want to put a question in the chat box, that would be okay too. So one question is, where did the data come from on attending a service a week?
Oh, I think it was the Pew Forum that put together that research.
Yep.
It was the Pew Forum or Gallup. I can check. Hold on. I think it was the Pew Forum.
Yeah, okay, that's very helpful. Yep.
Yes.
So we have 2 more minutes left for any other questions or thoughts. Well, one comment is that the American, just to reiterate your point, the American Heart Association recommends 150 minutes of exercise per week, about 30 minutes, 5 days per week. Yeah, this is very good to know. I hope some association will recommend one evening a week of unplugging from the technology that you referred to. I don't know of anybody making a recommendation like that, but that is so important.
Critical.
Yeah. Last question here from Mary Hewitt. Where can we find more teachings from him on spiritually integrated therapy? I just showed you this book. Would you have any other easily accessible places, Dr.
Sure, there
Rosemary?
are a couple. For those who practice cognitive behavior therapy, I have a book out with Guilford Press. So it's called Spirituality, Religion, and Cognitive Behavior Therapy, a guide for practitioners. And if you want something more research focused, which not even research focused, but basically to give you a summary of how is spirituality relevant to different disorders, whether it's depression or anxiety or suicidal ideation and these kinds of things. There's the Handbook of Spirituality, Religion, and Mental Health. And that's an edited volume that recently came out, which I was a part of. Those are a couple of volumes. Another, a seminal, much more seminal piece on spiritual integrated therapy, though, is by Ken Pargament, Pargament. Pargament.
Yeah.
He was my graduate school mentor, and he really wrote the book on spiritual integrated therapy. So that you can't get better than him.
Yeah. Okay. And the principles that you outlined are universal across all major religions, and I'm sure there is literature on spiritually augmented psychotherapy as applied to the different religions as well. Yeah. All right. So thank you very much, Dr. Rosemary, for that wonderful, very timely presentation, and thanks everyone for listening. This was great, and have a good rest of the day, everyone. Stay well.
Thank you.
Thank you.